So that's the procurement minister, Anita Anand, saying this is a rapid test, 15 minutes, it's a nasal swab. So now the government signed this new deal. They're going to buy almost 8 million of these rapid tests. As they say, they're supposed to be 15 minutes, but there's a catch. Health Canada hasn't even approved it. So what's going to happen? Meantime, wait times at testing centers, as you all know, are proving to be a huge issue. Parents are missing work. Kids are sick at home. They're stuck at home. So what do? Well, you know, should the government have pushed to get these rapid tests approved sooner? Why is the government pushing through a key vote also for supports for people who are still out of work so fast? So there's lots to debate. We're going to bring in MPs right now because ministers are in a cabinet meeting right now. So we're joined by the Liberals, by the Parliamentary Secretary to the Justice Minister, Arif Virani. He joins us from Toronto. In Ottawa, the Conservative health critic, Rempel Garner, joins us. And in Vancouver, the NDP's Deputy Health Critic, Kwan, joins us. Great to have all of you here. Mr. Virani, why did the government order 8 million tests before they've been approved by Health Canada?
So you heard Minister Anand speak there, Evan, and what she spoke about is procuring the tests. And the reason why we're procuring this test among many other devices, tests, kits, et cetera, is because we're being prudent in terms of prudently managing the public purse, but also prudent in terms of hedging our bets, so to speak, about what vaccines will work, what tests will work, ensuring that when the tests and the vaccines are all approved to standards that we believe and adhere to here in Canada by Canadian science, that those are available to Canadians in the quantities that are required. Canadians are frustrated right now. We sense that frustration. There are lineups around the country for having testing done. Getting tested is a good public health measure. We're trying to facilitate that, and we're doing that by ensuring that the scientists are empowered to get the test done. We've doubled the number of staff at Health Canada. We've also provided over $4 billion in funding to provinces for the purposes of testing and tracing.
But wouldn't it have been prudent, to use your word, to have asked Abbott to submit an application for approval months ago? You guys are buying a test now. They haven't even submitted their application. You could have said, hey, we like this test. It's been approved in the U.S. They've been using it for months. Approve it months ago instead of letting Canadians sit around in lineups that are 4 or 5 hours long. Why didn't you do that earlier?
So what we're doing is we're taking our cues from scientists and experts in the field and physicians. We have been doing that all along since the start of this pandemic, and that's proven to be the best course and the most appropriate course for managing the pandemic, especially compared with other G7 nations. We'll continue to do that. You see that with our vaccine immunity task force, our COVID task force, and you're seeing that again with what we're doing with empowering scientists. That's the course we're choosing to follow. We're not trying to politicize the pandemic. We're not trying to make partisan gain. We're certainly not trying to have politicians insert themselves where we just don't have the expertise to make those calls.
Michelle Rempel, what do you make of that? Does that satisfy you?
There's a lot of really technical speak, and what this boils down to is that I know that there's a mom who's watching your show right now whose child probably came home from school with a runny nose and a sore throat, and they're going, what do I do now? Because what that means is long lines in a testing center and potential isolation for the whole family for days while they wait for this test. And the answer for 6.5 million people in the U.S. is, well, we're going to have rapid tests and you could go get your nose swabbed and have that results in 15 minutes. These tests are being deployed in the U.S. as we speak. The answer for that same mom in Canada is, I have no idea when I'm going to have that advantage. And that's because the Trudeau government they've only responded to political pressure. So today, you know, there's people that are waking up in Montreal. They're facing economic lockdown as the only solution. We're going into the winter months. You know, patios are going to be closed. We've got mental health issues, people worried about losing their jobs. So the conversation you guys just had, what it boils down to is, when is somebody going to be able to get a 15-minute test or an at-home test in a long-term care facility so they can see their parents? On what day is that mom going to be able to test in her house? We don't have that answer because they've just been so behind the ball on this, and it's costing people their lives and their jobs, and that's wrong.
Kwan, what's your take on that? Are you satisfied that the extra money to Health Canada and the scientists are leading the way, or should the government have gotten these fast tests quicker?
Well, I think it's good that the government's finally taking some action. But it is something to note, though, that it's taking them this long to begin this process. Look at the Liberal government actually prorogued the House, and all of that was to focus on getting their actions together to address the pandemic in this next phase. We're into the second phase. This is the beginning of the second wave of the coronavirus. And then now the government's finally saying that we're going to sign this agreement to get some rapid testing done. Aside from the United States and other jurisdictions, the WHO has moved forward on this. Surely the government would have had some ability to connect with the WHO, with people who are using science to move forward on this question before this period in time. So we are absolutely behind the 8 ball. Parents, children, individuals who are waiting, lining up for hours trying to get a test. Some of them earlier in Ontario were sent home after 3 days of lining up and still can't get a test. This is a real impact for people. It's not, the government's going to have to answer for that.
Mr. Virani, 2 questions real quick on this. The basic question, when are these tests going to be available to people? And the second follow-up is, has the delay been because your government's actually concerned about the accuracy of the test, a test that has been used by tens of thousands of people in the United States?
So they'll be available as soon as we get the green light from the scientists and experts at Health Canada that the tests are accurate enough and reliable enough that they can go forward.
Respectfully, sir. Respectfully, is that a week? I mean, there are people in lineups today, businesses that were 7 months in. Respectfully, do you guys, has Health Canada said, well, I don't know, this is going to be a month, it's going to be a week? Can you give us a ballpark?
So, Evan, I'm not privy to that information. I can tell you that we are working diligently on it. We've doubled the staffing, as I mentioned to you, and I think it's inaccurate in terms of some of the things I've just heard from my colleagues. We've already approved 2 point of origin or quicker tests earlier on in this process. So the notion that we're only doing this now and we're late to the game is inaccurate. And secondly, just to Ms. Rempel's point, I mean, looking to the Americans for examples on how to manage this crisis is clearly not a science-based approach, nor has it been efficacious in terms of the number of cases and the number of deaths. So that is, we're not going to take our cues from the Americans with respect to this. Are we looking at, however, international models for tests and for kits? We are purchasing tests and the right to immunization and vaccines from around the planet, including the Americans. But we are not taking cues in terms of the management of the pandemic. We're not going to take cues from the management of the pandemic when the Americans' situation and statistics are as bad as they are.
Yeah, but people shouldn't be taking.
Michelle Rempel, go ahead.
People shouldn't be taking their cues from your government. I mean, you're making them wait in line for hours. You guys haven't been ahead on this. You're making them lock down. We're going into the winter months and you don't have a plan. Like, you guys have really messed up here. And that's cost people their lives. I mean, you guys came out and you said on the front end there was no person-to-person transmission of this. You didn't close the borders. And now what we need to do is get the tests in the hands of people who need them, which is everybody in Canada on a daily basis. And the fact that you can't answer that question, Arif, that the Trudeau can't answer that question is abysmal. It's a fail. And, my heart goes out to Canadians who are standing in line right now, who are desperate for this technology. And you've got this arrogant tone that's just, it actually makes me cry. We need to have this technology. And you coming on this show without an answer and these brutal talking points is not where we need to be in the middle of a national emergency.
All right, okay, hang on. I'm going to get to Ms. Kwan.
So Evan,
Mr. Virani, go ahead. Just answer that.
Yes, I'm going to answer it. And I'm going to put away the hyperbole, and I'm going to actually talk about the facts. And the facts are that the science, if I could finish, Ms. Rempel, the science is dynamic. And that's something that Ms. Rempel has failed to understand over the course of this entire pandemic. The entire science internationally about the way it was transmitted is the science that we followed. Ms. Kwan mentioned the WHO. We followed the guidance from the WHO back in January. The science has evolved on mass usage, on how it's transmitted. And we've been responding to the science and being led by science. And that's what we will continue to do.
Mr. Virani, just respectfully, hold on, and there's a lot, I don't want to argue the entire pandemic response. I just want to talk about rapid testing. No one's taking their cues from the United States political response. We're talking about the usage of the test. There are literally tens of thousands of people lining up. Can you give us an answer? Why did it wait so long for Health Canada to get this approved and for your government to purchase these when we're now at the back of the line? That's a very specific question, and I'd love to know the answer because Canadians want to know when they can get a faster test. It's critical to the economic recovery. Do you have an answer?
So the answer I will give you, it dovetails with what you asked me earlier, that there are concerns in the scientific community about the accuracy of a saliva-based swab as compared to a lab-based test. A lab-based test takes longer, but is more accurate. And that is the science that we are hearing and that we are listening to and that we are following at this point. Are we working hard to alleviate those concerns expressed by Canadians in the thousands? Yes, we are. And that's why we've committed $4 billion to this and also doubled the amount of staff at Health Canada.
Okay, guys, I have to give Ms. Kwan the last word on this. Jenny Kwan, does that satisfy you?
Well, the reality is that we are falling behind. That is the reality. And the reality is that Canadians are not getting the rapid test in a quick enough turnaround time. The government actually prorogued the House, stopped all the actions that needed to be taking place in the House of Commons to say that they need to focus in on a coronavirus pandemic response. And you know what? We're heading into the 7th month. And still, other jurisdictions have gotten ahead of us, and families are wondering, when are we going to get this test? The government just need to admit that they actually hadn't moved forward fast enough on this. Yes, doubling the staff, maybe you should have tripled the staff in order to get there. And we need to actually get there, because the winter months are here and people are waiting, and lives and safety issues.
All right, I think we just lost Michelle Rempel and Arif Virani, Michelle Rempel, Garner, and Jenny Kwan. I always appreciate the three of you. Lots to come. We didn't get a chance to talk about the confidence motions that are going to be debated tonight.